Today is World Tobacco Day, and my name is Omar bin Abdullah. You are watching MC Online TV, and we always advise people to keep watching MC Online TV with a special program, Woso Kebi. And we have a special guest from the CCTH, that's Cape Coast Teaching Hospital, Dr. Deborah Naaku Adoti. She's here to help us to educate the public concerning World Tobacco Day. And a latest statistic from the WHO, that's World Health Organization, said 2.4 million deaths globally every year. Those who people will say enjoy themselves with tobacco. That shows tobacco kills a lot. And again, it also destroys our environment. But today is World Tobacco Day. We are going to have a little education with Dr. Deborah to help us to educate the public. Dr. Deborah, thank you for coming and good afternoon.
Good afternoon. Thank you too for having me here today.
How do you see MC Online when we call you that we will have a discussion with you?
Oh, I was impressed that there are a group of people who are interested in knowing something about tobacco and also educating the public. So I think it's a good opportunity to talk about tobacco. And I hope whatever we discuss here will go a long way to help other people too.
Before we enter our questions, have you experienced people since in your life that they have gotten too much addicted to this tobacco and it endangers their life? Have you experienced it before?
Oh yes, there's several people, especially young people. They mostly come with the mental illnesses, psychiatric problems. But tobacco goes way beyond the mental illnesses, psychiatric problems. The long-term effects on our health, several illnesses, cancers, is even much more than the mental illnesses. So there's no exit. Whichever way you use it, you get one effect or the other. So it's very important we talk about tobacco and its effect on our health.
Right, Doctor, thank you very much for giving these little editorials to help us to move on our discussion. Doctor, so if somebody asks you, what is tobacco? What explanation will you give on a simple language?
Okay, so simply, tobacco is actually a plant with leaves that contain high levels of nicotine. That's an addictive substance. So that's what people usually go back to, is the nicotine in the tobacco. So the leaves are harvested from the plant, they are dried, they are processed into several substances and several products. So it's not just some are smoked, some are applied to the gums, some are sniffed, some are inhaled. So several products, the cigars, the cigarettes, snuff, and now there's even a new one the young ones are enjoying, the e-cigarettes. So what we mostly know here is shisha. Then it's not just shisha, even some people have, it comes in smaller packages like pen drives, pens, they're even nicer ones. So now and people think those ones are not harmful, but they are all harmful. There's no harmless one in it.
Right, Doctor, when you are explaining tobacco, you made mention of it comes with trees, different trees. People are also saying that this also destroys our environment. Will you buy that?
Yes, tobacco destroys our environment very, very much because these days it's a cash crop now. It makes a lot of money. So people are stopping their normal food production. So if I have maize and I think it's not giving me enough money and I'm a farmer, I'll stop doing the maize. I'll now produce tobacco so I can transport it, get a lot of money from it. People are cutting down trees. And tobacco, because I told you the leaves are dried, for every 300 cigarettes you produce, at least they use one tree to dry it. So you can imagine the number of cigarettes that are produced daily or yearly, and the number of trees that are destroyed to dry it, and the number of forests that are destroyed to plant it, and energy for transportation. They are produced in some hinterlands. You have to transport them to where they will be processed. Even with the processing, you would have to use energy, fuel. After you transport it back to those who use it, you use fuel to power your planes, your vehicles, and all that. So tobacco destroys our environment very, very much.
Right, we thank you, Dr. Deborah, very much. Now, this year, the theme for the celebration is World No Tobacco Day. Doctor, why do you celebrate these days? We have World Tobacco Day, we have this day. It's very important for us to celebrate the day.
The theme for this year's celebration is we need food instead of tobacco. Because now the World Health Organization has realized that a lot of farmers, as I said earlier, are destroying their food production. They are stopping it because now tobacco is giving more money. So why would we continue producing maize, rice, if we can get a lot of money from tobacco? So this year's celebration is we need food and not tobacco. Trying to encourage the farmers to continue with their food production and stop their tobacco because it's destroying the environment, destroying people, destroying the public, everybody.
Doc, 1987 is the day when World Health Organization started planning to celebrate these days. Since 1987 up to date, have you had some change from tobacco? People have stopped using it or what? Because since from 1987 up to date, we are continuing celebrating and people are addicted to.
Yes. So since 1987, as you said, that's the day they created the World No Tobacco Day. As you can see, a lot of people are getting the message, but because of the addictive nature of the nicotine, and young people want to explore, want to see new things. So if you try it once, twice, and you don't get help, you are likely to be addicted to it. I'm very sure that there have been some progress, but more people are getting into it than those getting out of it.
Right, if that is true, somebody will say, is tobacco harmful and why? Because if it's tobacco, some people are taking it. The thing is danger, they are destroying people's life. But still, people are doing it or taking it. So why, if the thing is destroying people, and still now they are taking tobacco?
Okay, so tobacco is very harmful. Other than the nicotine I spoke about, which is addictive, it contains a lot of harmful chemicals. So there are about 7,000 recognized harmful chemicals in tobacco, and about 70 of them are known to cause cancer. And other than the cancer, it causes a lot of other health problems. So we'll talk about the health problems first. So tobacco contains carbon monoxide, it contains benzene, arsenic, it contains formaldehyde, and so many other chemicals that are known to be carcinogenic, meaning they can cause cancer. The main cancer we know about is the lung cancer, and it's very evident that tobacco smoking is the leading cause of lung cancer. Also, it causes cancer from the head down to your bladder. So from the mouth, it causes cancers in the throat, causes cancers in the esophagus where food passes, causes cancer in the lung, as we mentioned. It causes cancer in the stomach, causes cancer in the pancreas, it causes cancer in the colorectal system, that's the colon, the rectum, where your food passes, it causes cancer in the bladder. So in medical school, when you are asked, oh, is risk factors, somebody has come with the cancer, risk factors for this cancer. Sometimes if you don't know anything at all, you can just mention smoking, and you are likely to be correct because it's known to be associated with many cancers. Yes, and also the diseases. So some of the chemicals in tobacco cause cholesterol accumulation in our blood vessels. So blood vessels is where blood passes into your organs. So if cholesterol is accumulated, that means it's being collected in the blood vessels. At a point, they'll become harder and they'll reduce the lumen of the blood vessel. So it affects mostly smaller blood vessels, which especially go into your heart, your brain. So tobacco smoke is linked to heart diseases, so coronary heart diseases, strokes, hypertension, diabetes, and so many other diseases. It reduces your immunity, so you can get diseases related to your immune system. It also increases your risks for other diseases like tuberculosis. So somebody comes with tuberculosis, and one thing you ask, do you smoke? And the person is likely to say yes. The tobacco brings down the protection in your respiratory system. The tuberculosis organism is all over. We all get exposed to it, but because our immunity is stronger, we're able to fight the disease. Because of the tobacco, you've reduced all the immunity in the respiratory system such that when the organism gets there, it easily gets you. And so many other diseases. It causes rheumatoid arthritis and so many other diseases. So tobacco smoking there's no free lunch. If you use it, you are likely to get something out of it, and not just one but several diseases, because it's systemic. It affects everything, and you're likely to fall ill and even die. Actually, the nicotine in tobacco, the tobacco plants uses that nicotine to ward off pests. So if the plant itself is using something, the nicotine to ward off pests, why do humans go in for that? So it means that at a higher level, it's likely to kill you because it was using that nicotine to kill pests. So at a higher level, it will also kill the human being as well.
Right, thank you very much. Doctor, you may mention some figures or whatever. We'll go for our commercial break. Then when we come back, we'll talk about a pregnant woman who is taking too much tobacco and whether it will affect the baby. Welcome back. You are watching MC Online TV, and today is World Tobacco Day. And our special guest is Dr. Deborah from CCTH, that's the Cape Coast Teaching Hospital. She's helping us to deliberate, discuss, put more information to the public that tobacco damage. Tobacco is harmful. Nti ya mama zene fi yentum na yansha ne so dam sane de sambo ho penfusi se don ho a obobo a onka nti obi hia the ofibere to bere no ebobo mazene fi yetum na yeje wusu pa no punoze oye zen angasa abira yerko no na yebisa oye Dr. Deborah there's a painful pa obo wusu no pa namba no obakan anado nankan. So we are going back to Dr. Deborah for her to explain whether a pregnant woman can continue taking tobacco till she gets birth, whether it will harm the baby or not. Doctor, you are welcome back.
Thank you. So even before pregnancy, people who smoke usually have reduced fertility. So men will usually experience low sperm count, some impotence, infertility. Women also are likely to have a lot of miscarriages. They are not able to get pregnant. But those who get pregnant and still use tobacco, the child is at risk of many complications. So the child can even have birth complications and congenital anomalies. The pregnancy is also at risk of a lot of complications. So there are stillbirths. Stillbirth means the baby is in the womb and dies. Preterm delivery, preterm labor, That means your date is not up, but you go into labor, the baby is born premature, and there are so many problems with premature births. Also, there are complications with so many other things. The mother is likely not to survive. The baby is also not likely to survive. The child's respiratory system is affected. So this baby comes out with a lot of respiratory problems, sometimes asthma and other things. So smoking and pregnancy do not go hand in hand in any way. So if you're already smoking and you get pregnant, you should please just stop for your baby. After your baby is born, you can start smoking again, but I also advise that don't smoke at all.
Doc, thank you very much. You made mention of low sperm count. Low sperm count comes from men.
Yes, yes.
So men who are smoking still not giving babies. Can somebody challenge you that I'm a smoker but still not giving babies?
Oh yes, so these complication risks and other diseases we are talking about, it affects people in different levels. It depends on how much you smoke, how long you've been smoking, and sometimes you probably even have a disease you didn't know about and you start smoking. It makes things worse for you. So it's not, some smokers will have children, but others are also not likely to have children. And you not likely to have children is higher. If you smoke longer, you smoke a lot, you've smoked for so many years, it affects your fertility too. So it's not for everybody, but your risk is higher for smokers.
Doc, let's check this. Heart attack or heart disease. Can we say most of them or some of them are smokers?
Yes, so I mentioned it earlier. So some of the chemicals in the tobacco, I told you carbon monoxide, the nicotine itself, and others, they increase your cholesterol level. And when your cholesterol level is going up high, it tends to coat your blood vessel. It accumulates in there. And when it accumulates, it will not be the soft cholesterol. It will thicken, to start thickening. And the blood vessel is a lumen. It's a channel where blood passes. So as it thickens, it will be thickening the lumen. Then your vessel becomes small. The lumen becomes smaller and smaller. And it's the same blood vessels that take blood to our heart. And those vessels are quite smaller than the bigger ones that bring blood out. So as it coats the smaller vessels, the lumen is becoming smaller. So when there's no blood going to the heart, likely to get a heart attack, you're likely to get a stroke, peripheral artery diseases, your legs and other things. So people who smoke are likely to get a heart attack than people who do not smoke. There are other diseases that increase your risk of getting a heart attack too. But if you smoke, you're at a higher risk of getting the heart attack than somebody who doesn't at all.
Yeah, you are watching MC Online TV, and today is World Tobacco Day, and we are lucky to have Dr. Deborah from CCTH, that's Cape Coast Teaching Hospital. So, Doc, let's get this straight. Whether youth, adults, or women and men who are at risk in terms of taking tobacco?
Okay, so I think men in the younger age group are more likely to smoke. But these times we are seeing a change. Women also want to explore. Women also want to see new things. We also want to do what other people are doing. So now there's a statistic that says that lung cancer in women, lung cancer kills more women than breast cancer, ovarian cancer, and uterine cancer put together. So it means more women are smoking. Women get lung cancer without smoking, but if you are smoking, you're at a higher risk of getting lung cancer. So this tells us that more women are smoking. But mainly it's the men and the youth that are more into trying to smoke. We want to try new things. We want to explore. We want to see what it is about. Yes. And the youth, there's a statistic that says from the CDC that says that every day there's about 1,600 young people, adolescents, that try their first cigarette. So we can see how harmful this is getting and how most people are getting into it. And once you smoke once, because of the nicotine we spoke about, you're likely to go a second time, then a third time, then you become addicted to it. Then your problems start from there.
Doc, since you start our derivation, you keep mentioning nicotine, nicotine. Nicotine means what in the cigarette or tobacco? When you mention nicotine is what?
Yeah, so it's a substance in the tobacco. That's the addictive substance in it. So that's what people go for. So the nicotine it affects the brain. So it's a chemical in the tobacco. When you take the tobacco in, it's absorbed into the blood, then it goes into your brain. In your brain, it makes you feel good about yourself. It relaxes you. So after taking the cigarette, you feel that you are so relaxed, you feel good, you feel some good pleasure. So why don't I try a second one? I'll feel better than a third one. And also, not just the nicotine, but it also increases something in our body called dopamine. Dopamine is with the reward system of the brain, what makes us feel pleasure and other things. So it increases that dopamine. So continuously, it increases your need to smoke again, get the nicotine, then it increases the dopamine, you need it again. So that's what causes the addiction. Yes. And also, as you continue to take it, initially, in the first instance, you tend to know that you get a lot of concentration. It increases your concentration, your ability to do your work. So in the young adults, you see, oh, if I take it, I'm able to concentrate better, I'm able to do what I have to do. But in the long term, it affects how the brain works. It affects your self-control, your attention. It affects your mood. So that's why when you take it at a younger age group, before 25 years, the brain is still growing. So from infancy to about 25 years, your brain is still not matured. And there's a part in the brain called the prefrontal cortex. That's one of the last parts to mature. So after about 15, 18, it's still growing. And that's when most people try their first tobacco. And that's part of the brain is responsible for something called the executive functions and attention. Executive functions is mainly organization, planning, memory, working memory, how to go about self-control. So if this part is not well developed and you start with the tobacco, the nicotine, it affects how that part of the brain works. You see, you'll not be able to control yourself anymore. That's why most of them get aggressive. Later on in life, they develop psychiatric problems. They develop cognitive problems. That's all because of the nicotine affecting that part of the brain. And they become also addicted to it because of the good pleasure they feel after it.
Right, Doc, thank you. Just a few minutes, we'll close this program. Doc, let's check whether you see some symptoms if you are going off way. Because so far as you are taking too much tobacco, whether if you are going off way, your behavior is keep changing. Will you see some symptoms, whether it attacks your heart? Will you see some symptoms or you won't see anything before whether you get a heart attack, low sperm count, whatever? Can you see some symptoms when you're taking too much tobacco?
Oh yeah, you can see some symptoms. You get to find out that you have some chest pain, some difficulty in breathing if you take it for a very long time. Even your own attitude, you see, sometimes you are told, sometimes you see it yourself. But the long and short of it is that the addiction is stronger than what you start feeling. Your need for it becomes bigger. So if it's just somebody complaining about my character, I don't care. I feel good when I take it, so who cares? I just have some chest pain. Maybe when I take some medication, I feel okay. So in the initial phases, they don't really care about what they start feeling. They sometimes don't even associate it with the tobacco taking. Yes, until it becomes full-blown illness, cancer, before they get to know, oh, what I was doing is what has led me to this. Yes, so they start feeling it, but the nicotine is stronger.
I see. If I'm taking tobacco and I want to stop, what can I do?
Taking tobacco and wanting to stop is the best decision any smoker can take for their health. Stopping tobacco, immediately you stop for a few days, for a few weeks, there's even a change in your health. You feel better about your health. You feel you can even breathe better. You feel you are stronger. The chest pain and other things decrease. So that decision goes a long way to help the smoker, goes a long way to help their relatives, because it's not just about the smoker. Your smoking affects the other people around you. That's secondhand smoke, and all the risk factors that a smoker is open to the second-hand smoker is also at risk of all of them, the cancers, the heart diseases, because it's the same thing they are inhaling, even though they haven't smoked. So deciding to stop smoking goes a long way to help the smoker and even the entire society. It reduces your risk of getting all the cancers, the diseases after some number of years. So if you want to stop smoking, in my own way, I would say you should seek for help. Sometimes when you have somebody helping you, you are accountable to somebody, you are likely to stop than you just deciding in your room, oh, I'll stop smoking. You are not likely to be able to stop. By 2 days, you go back to it. So finding help, especially professional help, would help you a lot. Seeing the psychologists, the public health nurses, and other professionals would help you a lot. And also, not going back to your triggers. So there's a friend who makes you smoke. There's a friend who, when you see, is already a chain smoker and you are likely to smoke. You are not supposed to see that person if you have decided to stop. So if you've decided, oh, you cut that friendship, there's a club when you go to, you smoke, you stop going to those places, bars, clubs. And also in that moment, you are not supposed to entertain the thought of, oh, just one. If you tell yourself just one, before you know it, you are done with a pack. Yes. And also, you're supposed to find other means of relaxation. As I said, when they take it, they feel relaxed. Some even smoke to relieve stress. So find other means of relieving that stress, listening to some music, listening to, watching a movie, trying some yoga, exercises. It helps you a lot. And also finding nicotine alternatives. So there are some patches, nicotine patches, gums, and other things you can use. Those ones don't come with the toxic chemicals, and those ones, especially when you seek professional help, they are able to tell you how much you should take. Then they will be reducing it as the time goes. So with those ones, you get the nicotine in metered doses. They try to help you. Okay, this week we do 2, the next week we'll be reducing it. So it gradually helps you to stop the smoking. And also you should think about the benefits as you, oh, I want to stop. So you think about the benefits. It helps you, gives you a better life, it reduces your health risk, and even financially, if you think about the money you are using to buy the cigarettes, the cigars, the shisha, if you find a susu box and you put it inside, you realize that you are getting some money, yes. And also the benefits to your family members, your children, and other people, yes. So if you think about all those things, you'll be able to stop at a point. One thing is, it's not easy on your own because of the addiction. It's from the brain, so you need help. And if you decide to stop, you're likely to be able to.
Dr. Deborah said if you decide to stop, you can stop, but our time is up. So, Doctor, a little advice, and I'll be more happy if you stretch it to the youths.
Okay, so the advice I would like to give is that there's no harmless form of the tobacco. So now the new ones that are in shisha and other things, they would say, oh, this one is harmless, it doesn't contain all the toxins and things. But one thing is, there's no harmless form. And you can stop if you want to stop. A lot of people stop smoking tobacco every year, and you can decide to be one of them. You shouldn't let nicotine glue you to smoking tobacco every time. Become a chain smoker because of that. And also, stopping smoking gives you a lot of health benefits, improves your life, and even makes you a better person. Thank you.
Thank you too. Well, thank Dr. Deborah Aku Adoti from CCTH, that's Cape Coast Teaching Hospital. She has educated us a little more on tobacco use and a lot of information. So the youth out there, we should all move ahead and watch MC Online TV. Remember that today, 31st May 2023, is World Tobacco Day. We should rather plant many food and stop planting other tobacco trees, and it will never help us. So let's take the message very, very, very serious. Ebe do baby arasi the wotumina oze nenyuwa afem here no mwahwe oye MC Online TV. Well, oye in the Radin Fan Hinara, you celebrate oye World Tobacco Day. You wusiwa horwa yepi, we hinenum, we hinenum, what baby are wusu no to mufano, your mamma's nephew into me in jay. That's a say ye being nephew etum every wusu ni pinyana, and yim there where umayina damano or babafum. Besiaso na atai wusu ni pinyana, and shiny ye ya. Na woba na pom zene samno so etum na akufom. Tobacco kriara ewe ni pinyano so obutum ama wa akoma no ho etum atochema. Nti ema mazen na nzema pi wa keke ni hara yentum na yefan yedwuma. Ana babo ma etum etu ana mar pinyen akọ. Enkankan mmebu na youth. Ema mazen na fi entum entwi hi won fi. That will see. Say eba mazen na ijai oye wusu no no pinyen a oye tobacco no. Na sika na ezekotene na abosusu box de biara nda akotum sa bosomoko na ewi tobacco na nkwa na bosomokren azi 100 Ghana da awia ibu 100 Ghana na do obutum na wa abo nti yema maze na fie ntum na yentwi hiwo fim shano so de World Health Organization which them WHO wasi yimpa opipi ebie nature power and 2.4 billion sorry million na oye afibiara wohwer ho nkwa woye tobacco nonum ho nti ema maze na fi yentum yentwe hiwo fim. We'll continue thanking Dr. Deborah for helping us to educate the public. Doctor, definitely, I think we will invite you more. So far as we'll start with us and you continue helping us to educate the public because there are many things going out there we're supposed to maybe gradual process to help. So we thank you very much. And we thank MC Online, the technicians, Mabede Mbiara, Ebifufure Basani Yeshebi. This is Omar bin Abdullah. Bye-bye.